Let's talk about chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease is also known as COPD. It is a progressive lung disease that makes it difficult to breathe. COPD typically includes two main conditions: chronic bronchitis and emphysema. Chronic bronchitis involves inflammation and narrowing of the bronchial tubes, while emphysema involves the destruction of the air sacs in the lungs. The symptoms of COPD can vary in severity but generally include 1. Shortness of breath, especially during physical activity. 2. Persistent cough with mucus production. 3. Wheezing. 4. Chest tightness. 5. Fatigue. 6. Frequent respiratory infections. To get diagnosed with COPD, a healthcare professional will typically consider several factors. They will review your medical history, conduct a physical examination, and evaluate your symptoms. Diagnostic tests such as spirometry, which measures how much air you can exhale forcefully, are commonly used. Other tests like chest X-rays and blood tests may be performed to rule out other possible causes of your symptoms. While there is no cure for COPD, there are several ways to manage and treat the condition. Lifestyle changes. Quitting smoking is the most crucial step in slowing the progression of COPD. Avoiding exposure to lung irritants such as secondhand smoke, air pollution, and chemical fumes is also essential. Medications. Various medications can help manage COPD symptoms, such as bronchodilators to relax the airway muscles and reduce shortness of breath, and inhaled corticosteroids to reduce airway inflammation. Pulmonary rehabilitation. This program involves exercise training, breathing techniques, and education on managing COPD. It can improve exercise capacity and quality of life. Oxygen therapy. In severe cases, supplemental oxygen may be prescribed to increase oxygen levels in the blood. Surgery or lung transplantation. In some advanced cases, surgical interventions like lung volume reduction surgery or lung transplantation may be considered. COPD can lead to various health problems and complications, including respiratory infections. COPD makes individuals more susceptible to respiratory infections, such as pneumonia and acute bronchitis. Heart problems. COPD can strain the heart and lead to conditions like cor pulmonale, which is the enlargement and failure of the right side of the heart. Depression and anxiety. Living with a chronic condition like COPD can impact mental health, leading to feelings of depression and anxiety. Respiratory failure. In severe cases, COPD can cause respiratory failure, where the lungs are unable to provide enough oxygen to the body. Finding help and support for COPD can be beneficial. Here are some resources you can consider. Healthcare professionals. Consult with your primary care physician, pulmonologist, or respiratory therapist for guidance, treatment options, and disease management. Support groups. Joining local or online support groups can provide a sense of community and a platform to share experiences and coping strategies with others facing similar challenges. COPD foundations and organizations. There are several organizations dedicated to COPD, such as the American Lung Association and the COPD Foundation. They provide information, resources, and support for individuals and their families. Remember, it's essential to work closely with healthcare professionals to develop a personalized treatment plan for COPD based on your specific needs and circumstances. Thanks for watching Med2. Please check out our other videos, and stay healthy.